In that bottle is a hope of a cure for Dave Gort. It's a new treatment for hepatitis C.
After 2 days, I just felt my energy levels increase enormously. I just felt so much better. It sprung out of bed in the morning. It just makes me realise how poorly I actually was.
Dave Gort is a haemophiliac infected with hepatitis C 22 years ago from contaminated blood. He now has cirrhosis of the liver. And yet he's paid for this drug himself, £45,000 for a 12-week course, using, as it happens, money given to him by the government because the NHS infected him.
I think I get increasingly angry and trying not to, but it's just so frustrating really that there is that drug available and people can't access it. And I've been fortunate in that we kept the money from the Skipton Fund and have been able to pay for this. But if it does go past the 12 weeks, we've suddenly got to find £50,000 potentially to pay for the next 12 weeks.
But he's not the only one feeling angry. There are now claims that NHS England is using delaying tactics and even issuing what some have described as threats during the process by NICE to approve these new treatments. This is what's happened so far. In January, NICE gave the go-ahead to the Gilead drug Sofosbuvir. But NHS England asked for an unprecedented delay of 6 months before it could be prescribed. Then NICE began appraising Harvoni. This is Sofosbuvir combined with another drug. Now, an extraordinary claim has been made against NHS England that, at a meeting on April the 1st to discuss these new generation of hepatitis C drugs, officials warned NICE that if they made the wrong decision, that they would seek judicial review. Charles Gore from the Hepatitis C Trust was at that meeting.
I definitely felt that they were suggesting that if NICE did not conform to what they would like to see happen, which would allow NHS England to manage, or actually, let's be brutally honest about this, to ration access to the drugs, then they would potentially take judicial action against them. Yes, I definitely got that impression that there was a threat there that NICE should conform or face potentially serious sanctions.
NHS England failed to answer our specific questions, but said it was supportive of new treatments.
We also want to ensure that unresolved questions about the best treatment strategies are answered and that phased investment in hepatitis C services does not cause damaging cuts elsewhere.
While NICE said NHS England was not compromising the independence of their work. At that April the 1st meeting, we are also told that NHS England officials claimed that if these drugs were approved, it would cost £1.3 billion, and that NICE had a legal duty to consider the impact on the health service.
This is quite clearly an exaggeration, and I believe that NHS England know that to be the case. In fact, we couldn't possibly ramp up the level of treatment to the extent that they're suggesting. In reality, it would probably cost about £350 million per year at most.
There is no doubt these drugs are expensive. Professor Thurs himself says he even has some sympathy with NHS England's plight. Yet, there is also concern that because the vast majority of cases are from injecting drug use, they are being considered an easy political target.
That's what I'm most concerned about, that people with hepatitis C are being picked on. And this is particularly unfortunate because overall, people with hepatitis C are a disadvantaged group.
But there are also those infected by tainted blood. And in March, there was an apology.
It is difficult to imagine the feelings of unfairness that people must feel at being infected with something like hepatitis C or HIV as a result of a totally unrelated treatment within the NHS.
Dave Gort, like many of those infected, believed this would now lead to treatment. Even though NHS England had its 6-month delay for Sofosbuvir, they had agreed that those with cirrhosis should be treated early, but that hasn't yet happened. In fact, even as early as January, he'd told his consultant he would pay for the drug.
It's like a black cloud hanging over me, the worry and stress of mainly of cancer really, was one of the biggest things. And at that time he said, if I can encourage you not to part with the money at this stage, because I do think NHS England will get their act together by April, and soon after we'll be able to give you the drugs. In April he said, I'm really sorry to say this, but they haven't got their act together.
And so he did pay buying Harvoni, and already there are signs it's working. But if he needs another 12 weeks, the total cost to the man infected by the NHS will be £100,000.